All right. Good evening, everyone. Thank you all for being here tonight, and thank you for the invitation to speak. I would especially like to thank Cindy and Paul for organizing this event, and I know that events like this do not happen without a tremendous amount of work, and so I'm really grateful to be a part of it tonight. So my name is Vanja Cabric, and I'm one of the pediatric oncologists, and I'm a physician scientist, and I work at Memorial Sloan Kettering Cancer Center. And I work alongside a clinical team called the Rare Services Team, and where I work with Dr. Gladebender, Dr. Michael Ortiz, who we heard about, as well as Talia, our amazing nurse practitioner, who's here with me tonight. And these names may be familiar to some of you. Our team cares for children and adolescents with rare pediatric cancers. And while taking care of patients and their families is the most meaningful part of my job, where I spend the majority of my time right now is actually in the laboratory, where I work under the mentorship of a brilliant immunologist called Dr. Chrissy Brown. And if you'll bear with me, I just want to tell you a little bit about the research that I do, because it excites me. So at the heart of my research is really one simple question, and that is, how do pediatric cancers escape the immune system? And so the research that I do focuses on understanding what's unique about the developing pediatric immune system. We know that over the past several years, we've actually identified several specialized immune cells that seem to be most abundant in early life. And these cells are really important for teaching and training the immune system to learn to react to things that are harmful or possibly dangerous, while also suppressing immune reactions against things that are not harmful in the environment. And this fine balance in what we call inflammatory responses and tolerogenic immune responses is actually essential for healthy development. And it's what helps children adapt to new foods that they eat, as well as healthy gut bacteria that colonize our gut, as well as novel exposures that they encounter early in life. But this also raised a really interesting question, which is, could some of these same immune mechanisms that are actually suppressing immune reactions to harmless stimuli in the environment actually be allowing tumors to escape immune detection and clearance? And so to answer this question, I've been studying how the immune response to cancer differs in children compared to in adults. And our work has actually identified several interesting immune pathways that are particularly active in early life and suppress effective tumor immune responses in children. And why this is particularly important is that understanding these differences is critical, because many immune-based therapies or immunotherapies that are particularly effective in treating adult cancers have been fairly ineffective in treating pediatric cancers. And so ultimately our goal is to identify and develop pediatric-specific immune-based therapies, which will provide novel treatment options that are both safe and effective for children with rare and difficult-to-treat cancers, where treatment options are often limited. Research like the research that I do is only possible because of philanthropic support. After completing my medical training in 2024, it was actually philanthropic grant funding that provided me the opportunity to continue my work in the laboratory for an additional 2 years. Funding for early career investigators like myself and innovative research projects like those that Dr. Ortiz carries out create something incredibly valuable, and that is time, which we've been hearing about. Time to ask important questions, time to pursue new ideas and make discoveries that can ultimately improve the lives of children with cancer. So the advances we celebrate in pediatric oncology today did not happen by chance. They happened because people believed in the importance of research and chose to invest in it. Every breakthrough begins with a question, and philanthropy helps give researchers the opportunity to find the answers. And so on behalf of physicians, researchers, patients, and families who benefit from your generosity, thank you.